Hello, this is Dr. David Green, CEO of the Florida Pain Network. Today's topic is what are the available knee injections for arthritis? Over 40 million Americans suffer from arthritis, and it's the leading cause of disability in the U.S. Interestingly, there are more women than men suffering from arthritis by 20%. The total costs, indirect and direct, exceed $100 billion a year. Between 2000 and 2010, the number of knee replacements in the U.S. doubled. I can tell you right now the population did not double in the U.S. between that decade. About 600,000 knee replacements are performed each year. By 2030, the demand could reach $3.5 million, half million procedures annually. 35% of those with a knee replacement are between 50 and 69, so relatively young. It is a quality of life procedure. It's elective. It should only be performed after considerable conservative treatment has been performed, which may include anti-inflammatories, Tylenol, prescription pain medications, topical or prescription pain creams or patches, physical therapy, and possibly bracing. Now, knee injections have been performed for knee arthritis for decades and decades. We're going to go through these: cortisone, hyaluronic acid, and then regenerative medicine injections such as PRP, bone marrow aspiration, and amniotic-derived stem cell therapy. So cortisone since the 1950s has been a mainstay and the gold standard. Initially it was performed for rheumatoid arthritis, and then a few decades later it spanned over into osteoarthritis, which is wear and tear arthritis as well. Steroid injections don't cure anything. They don't cure cartilage, they don't cure ligaments or tendons. They provide excellent pain relief and treat inflammation. It is questionable whether or not they harm cartilage. Studies in small animals showed that they did. Studies in large animals showed that they did not, and then studies in humans have not been performed on that subject. It's kind of a theoretical. There are studies showing 75% good to excellent results with cortisone injections for knee arthritis, and the pain relief may last for months at a time and then be repeated. Hyaluronic acid injections have been a great addition to the non-operative treatment for knee pain. Hyaluronic acid is the motor oil normally found in the synovial fluid of joints. In 1997, the FDA approved the first hyaluronic acid preparation. It's made from rooster combs, incidentally, and it's called viscosupplementation. Numerous trade names are now available, including Hyalgan, Synvisc, and Orthovisc. They're pretty much all the same. No study has shown superiority with the various products. One of the largest U.S. studies in the U.S. showed beneficial effects in 80% of patients for over 6 months. That was the part and parcel of why the FDA approved it. The theory is that it provides lubrication, which is what hyaluronic acid does anyway. It's anti-inflammatory, and the theory is that it compels the joint to produce more cartilage. So it does fall into the regenerative medicine category. PRP therapy is short for platelet-rich plasma therapy. It involves a simple blood draw and then a centrifuge to concentrate the platelets and growth factors. It's been shown that there's about 7 different types of growth factors in PRP. 1 to 3 injection is placed over time into the painful knee, and several studies have showed significant pain relief. One showed 70% good to excellent results at 6 months, and another showed preservation of cartilage in over 70% at 1 year, and that was on serial MRI scans. So it's been very impressive. Now, when you start looking at stem cells, PRP therapy is not an actual stem cell injection. It does recruit your body's stem cells, but when you start talking about stem cells themselves, these have the potential to alter the course of arthritis and not just to mask pain. There are several different kinds: bone marrow-derived, fat-derived, amniotic-derived, and these involve mesenchymal stem cells. None of them have embryonic stem cells in them. Some studies have shown excellent results. There was one for knee cartilage defects showing 6 months after transplantation, the patient's clinical symptoms had improved, and the improvements had been maintained over the follow-up period of 2.5 years. There have been no large clinical studies in humans yet, but there's lots of small studies showing effectiveness. The bottom line is that there are various types of knee injections now available that provide non-operative pain relief. They are all low risk and outpatient. In combination with other non-operative treatments, they may help delay or even avoid the need for a knee replacement, especially if you're young. In that 50 to 70 category, knee replacements are not meant to last forever. They do have some significant potential complications with the procedure. And all of these procedures can be repeated every 3 to 6 months as needed. Top non-operative pain management in Florida is through the Florida Pain Network. There are many clinics throughout the state accepting over 50 insurances in the network and over 25 treatment options available with the board-certified, award-winning doctors. In the Tampa area, visit painmanagementtampa.com and then call us for more information and scheduling at 813-666-4399. I'm Dr. David Green with the Florida Pain Network. Your pain stops here.